So clinical outcomes, what did we find from all these 12,000 articles? What did we find? When we looked at survival, weighted survival, apples to apples comparison, we found the root canal teeth were exactly the same as the implant single crown, exactly the same. Really surprising and disappointing thing was the fixed dental prostheses, the bridge, the 3-unit bridge. And I love to fix pros, that's why I became a prosthodontist. Very disappointing, lagging way behind. So I think this means that now a bridge is not going to be our first choice, maybe not even our second choice. So it's root canal treatment, saving, retaining the tooth, or replacing with an implant. Those are our first choices, not the traditional fixed bridge. But what do patients feel? Psychosocial impact, because it's the patients that we're serving. It's the patients that live with our therapies, prostheses. Well, root canal treatment, people are anxious about it. Root canal treatment also provides overwhelming relief of pain. Whether the tooth is replaced by an implant or retained through root canal treatment or replaced with a fixed bridge, as long as the patient can smile, they're very happy. Would you choose to have the same treatment again? Absolutely, if it's a root canal treatment or an implant. Are you satisfied? Absolutely, if it's a root canal treatment or implant. Would you recommend it to somebody else? Absolutely, if it's root canal treatment or implant. Economics, we looked at the initial costs, and these are just the initial costs from the ADA Services Rendered Survey. So this data is now about 10 years old. The ADA don't do this survey very often. But what was really clear is the initial cost of the root canal treatment was about half that of the other options, half that of the bridge, half that of the implant, regardless of whether the treatment was provided by a generalist or a specialist, regardless of whether it was a front tooth or a back tooth. So the initial costs, the root canal treatment route is way, way lower, about half that. Something that Jack Brown, healthcare economist, dental healthcare economist, explained to me, and he's the gentleman who carried out the ADA Services Rendered study for many years. He said the natural state has intrinsic value. The onus is on the alternatives to the natural to show that they're either cheaper or better than the natural. So cheaper or better, that's the way the healthcare economist thinks.